So next is V30 pediatric trauma. An 8-year-old boy was hit by a car traveling at 35 miles per hour. He was thrown to the pavement and hit a tree. He was alert and oriented at the scene and complained of the left upper abdominal pain. He is brought to the ED. How will you manage this patient? So I will approach this patient by ATLS principles. I will perform primary and then secondary survey and assess the GCS. So airway, check airway and by fixation of the C-spine, breathing and ventilation, control for bleeding, 2 cannulae, FBC, UNEs, coagulation, cross-match, and acquire appropriate imaging that includes splenomegagraphy, ultrasound, and CT, decrease GCS and suspicion of raised blood pressure or spinal injury, warrants CT scan of brain and spine as per NICE guidelines, and appropriate intervention or referral. If GCS is less than 8, child should be intubated and ventilated. CT scan of the abdomen and thorax with IV is the gold standard investigation in a stable child following trauma. So Broslow tape helps guide the fluid and drug dosages. So Broslow, this is a buzzword, Broslow. How much fluid will you give to this child? The fluid requirement is guided by the hemodynamic stability, blood pressure, and the blood test markers of the hypoperfusion. 2 boluses of 20 ml per kilogram normal saline may be given, tested with 1:1 ratio of packed red blood cells and FFPs. If the child remains hypotensive, I would then give 10 ml per kilogram of packed red blood cells and continue cessation of the blood products. What is the principle of management of solid organ injury in the pediatric patients? If the child is cardiovascularly normal, respond to resuscitation, conservative management is routine with IV fluid, blood transfusion, FBC, and bed rest. The only indication for surgery is failure to respond to resuscitation, ongoing blood loss and deterioration, are confirmed or suspected presence of hollow viscous injury. What is the seatbelt sign? Bruises or abrasions on the anterior abdominal wall due to the restraint of the seat belt. The pattern of bruising mirrors the position of the seat belt. It is more common with a lap belt than a traditional seat belt with 3-point mid restraint. It implies a significant transfer of energy and may indicate an underlying visceral injury like duodenal transection, mesenteric hematoma, retroperitoneal injuries, lumbar spine fracture like chance fractures. A 12-year-old boy hits the curb while riding his bike and flips over and he lands on the handlebars. What are the possible injuries? So transection of duodenum, duodenal hematoma, pancreatic trauma, splenic injury, and deceleration injuries. Thank you.